name's Rachel, I'm with the doctors. Can I just confirm your name and date of birth, please?
Yeah, it's David Hewitt, 13th of March, 1969.
Are you okay if I call you David?
That's fine.
Okay. Today I've been asked to do a cardiovascular exam. What that's going to involve is me having a little look at your hands and your face, exposing your chest, and then having a listen in. Does that sound okay?
That's fine.
So I'm just going to talk my way through the exam. So starting from the end of the bed, the patient looks comfortable at rest. They're not obviously short of breath, and looking around the bed, there's no signs of any medications or GTN sprays. The patient's not on any cardiac monitoring and they're not on any oxygen. Have you got any pain in your ankles, David?
No.
I'm just going to give them a squeeze. Looking for any signs of peripheral edema. There doesn't appear to be any. And have you got any pain in your calves at all?
No.
Giving them a squeeze, and they're nice and soft and non-tender. Can I just see your hands, please? First of all, just feeling the temperature of the hands. They feel warm. Checking CRT, holding for 5 seconds. And that's less than 2. Looking at the nails for any signs of splinter hemorrhages, any tar staining. Could you go like this for me? Looking for any signs of finger clubbing. That's fine. And if you just flip your hands over, looking for any pulmonary edema, any Janeway lesions, or any ulcerous nodes. Fine. And I'm going to assess the pulse. Ideally timing the rate. Also commenting if it's regular or irregular, and that feels regular. And I'm going to assess for any radial delay. And they feel the same on both sides. Have you got any pain in your shoulder?
No.
Checking for any collapsing pulse, and there isn't any. Then moving up the arm, I would also comment that ideally I would take a blood pressure reading as well, measuring 3 times and taking an average. Can you just pop your head back? Now I'm going to assess for the JVP. Have you got any pain in your tummy?
No.
Nope. Okay. Looking for any hepatojugular reflux. And the JVP is not over 3 centimetres, so it's not elevated. Fine, then I'm going to move on to look at the face. I'm just going to pull down your lower eyelids, okay? If you could look up for me. There's no signs of any pallors of conjunctiva. No xanthelasma around the eyes, no corneal arcus. Can you open your mouth for me and stick out your tongue? No signs of central cyanosis, and the dental hygiene appears fine. Then I'm going to move down to inspection of the chest. There's no obvious deformities. There's no scars, making sure that I check in the axilla. No rashes or bumps or anything like that. So I'm going to move on to palpation. So I'm first going to feel for the apex beat. So I'm going to go to the second intercostal space. 5th intercostal space, sorry, mid-clavicular line. And that's not displaced. Then I'm going to feel for thrills across all 4 valves. I'm also checking for any heaves. And that's fine. So I'm going to move on to auscultation. Are you able to hold your breath for me, please, David?
Mm-hmm.
And you can breathe normally. Checking for any carotid stenosis, there doesn't appear to be any, so I'm going to move on to listening to the heart valves. So I'll first go to the aortic valve, second intercostal space, right sternal border, timing it with a radial pulse. The pulmonary valve, tricuspid. Are you able to lean forward for me? And on your exhale, can you hold your breath, please? That's great, and you can breathe normally and lean back. And it goes to the mitral valve. And are you able to roll onto your left hand side, please? Thank you. Making sure I listen into the axilla as well for any radiation of any murmurs. And then if you just stay on your left hand side there, I'm also going to listen to the mitral valve. It's the bell of my stethoscope. That's great, you can lie back. Perfect. In summary, this is a normal cardiovascular exam that I just performed on David. Ideally, I would also perform an ECG and do a full respiratory examination as well. I could also do blood pressures at this stage, and if I thought that it was warranted, I could do a chest x-ray as well. Thank you very much, David.
Thank you.